Hello, everyone, and welcome to another episode of Behind the Paper, the official podcast of the Transplantation Journal. I'm your host, Dr. Macy Levan. I'm the social media editor. And today I'm really pleased to bring you a special conversation featuring Dr. Fadi Issa, who's the executive editor for special features at Transplantation, and Dr. Nadey Hakim, who is the president-elect of the Transplantation Society. Together, they discuss Dr. Hakim's newly published special feature, reflecting on an extraordinary career that has helped shape the field of organ transplantation and continues to inspire generations of transplant professionals. Whether you're a surgeon, physician, scientist, trainee, or simply interested in the evolution of transplantation, I think you'll really enjoy this conversation. Now, here's to Dr. Fadi Issa with Dr. Nadey Hakim.
Nadey, thank you so much for joining for this TTS podcast. Really grateful for your time and to hear more about you, your career, and your thoughts on the future. And this is obviously based on your fantastic People in Transplantation piece, which has come out in Transplantation, which has been very well received. And I think people would like to hear more about you. So I have a few questions, and hopefully, please just answer as you see fit. If there's anything you don't want to answer, just don't. So I just to ease you in a bit. Everyone knows you're a world-renowned transplant surgeon, and you've been part of lots of world firsts and contributed hugely to transplantation worldwide. But if you had not become a transplant surgeon, what would you have done?
That's a very good question. I think I would have certainly been a surgeon.
Mhm.
I can't see myself doing anything else, to be honest. I love it so much, and I remember even when I was 4 or 5 year old, I always wanted to be a doctor,
Mm.
and I think I always like to make use of my hands, and this is something which I find very natural to do. And when I operate, and it's like you driving the car. So I love it. But I've got other hobbies. I consider surgery for me as a hobby because I love it so much. But I think I would have maybe done, music or sculpting. But I think
Mhm.
mainly the breadwinner is certainly going to be surgery.
Surgery. You like doing things with your hands, I can tell. So that's very important to you, the
Uh,
practical element of the work. Yeah. And looking back over your career over many decades, what was there a patient who perhaps changed the way that you think about medicine more than any others? Did you come across that sort of patient in your career?
the when I was training in surgery, and that's how I became a transplant surgeon, in addition to being a general surgeon, I was on a rotation at Guy's Hospital and working with a transplant surgeon. And I remember one word he mentioned during the operation. And he said, every time I transplant a kidney and I see urine coming out of that ureter, it's a miracle.
Mm.
At that time, it did not register much, but I think he's so right. Until now, and I do still many, many transplants a year. I mean, certainly single-handed, I would do over 150 kidney transplants myself, so a year. And
Mm.
every single time I put in a kidney in, it is a miracle because this kidney was in ice. It's
Yeah.
dead and comes back to life, which is the basis of transplantation as such. This is what we do on a daily basis. We revive organs which supposedly are dead. This is why I love it. And I think, and I call transplantation the most optimistic specialty ever. You can't have better than this.
Mm.
Oncology is pessimistic, neurosurgery is pessimistic. You can always, you have to fix things, and it's never 100%. With transplant, you truly can achieve 100% success. That's what I
You
love about
restore,
it.
yeah, you restore function completely don't you, to a function that was completely lost. And actually, there aren't many operations where you know the outcome instantly has been successful, are there? I can't think of any where you know straight away, oh yes, it's
E-
worked.
Exactly. Actually, funny enough, I just last week I did for the first time ever a kidney transplant, live related, uh, son giving his father a kidney, and the recipient, in addition, had a small tumor in his native kidney.
Mm,
So for the first time, I did a native nephrectomy
mm.
and a kidney transplant on the same day, which we doubled the success. Not only we cured him from cancer, and indeed the kidney was completely, the margins were completely clear, and he underwent a kidney transplant. So this is fantastic specialty. I love it.
I can see that. I agree. In fact, lots of oncological operations, you remove function at the cost. The cost is removing function by removing the tumor, whereas here you restore it at the same time, which yeah,
I've never
very,
done it before, and
yeah,
the oncologist will say, "Oh, put the kidney in, and then 6 months later remove the kidney." I said, "I sorry, but this is nonsense. I mean, you're going to be putting immunosuppression in a patient. That cancer, which is small, might very well spread. Let's
yeah.
do it on the same day." And the patient was very happy. I was very happy, and the hospital, where we've never done it before, are so excited about it.
It's great. Yeah, it's a great story, great case. So, transplantation surgery has evolved a lot, hasn't it, over the past few decades again. What do you say has been the biggest innovation in transplantation? Is it better patient selection, better technology, better organ preservation, immunosuppression? What do you think has had the biggest
I
impact?
would say undoubtedly immunosuppression. I mean, I remember when I first started doing kidney transplants in the late 80s, the success rate was 75%. And now, if we do not get 99%, it's a failure. And all boils down to intelligent immunosuppression.
Mm,
And we are giving less and less immunosuppression, but more targeted immunosuppression. And this is why I think it's a true miracle. We are having healthy patients who look amazing. I mean, just before starting my podcast today, I had a patient who came to see me. I had done her transplant, believe it or not, in Nigeria a year ago. And she
mm,
called and said, I'm in town. And you remember you took my daughter's kidney and you gave it to me a year ago. And her function is perfect. Her creatinine
mm.
is 52. Her GFR is 123, which is, better than you can ever imagine. And this is a kidney which was done in Nigeria.
Yeah,
People would not believe that. So,
yeah,
which shows that what my aim as a surgeon and currently president-elect of the Transplantation Society is to spread transplantation to everywhere. It should not be linked to nationalities, race. Everyone should be offered that success and that gift of transplantation, regardless of whether they've got money or not. And this is what I think we can achieve together in the next few years.
yeah, yeah. It's great. It's great, and I mean, immunosuppression has certainly revolutionized the field, but there's still more to do. And I think that's very interesting about transplantation in that there's still a lot to learn and improve, and it's a field that's constantly developing. But coming on to your international work, I wondered whether you could tell us a bit more about that, where you've started transplantation programs and where you've contributed and so on. It would be very interesting for people to hear about that.
The first time I did a kidney transplant outside the UK, and it was actually a charity work which was funded by the Saudis,
Mm,
was in Aden in Yemen. That was
mm,
in 2003 during the Iraq War. And we went there and we flew in. I took my registrar with me, and we did, I think, 7 kidney transplants in a place where they've never done kidney transplant. We've done it in 4 days, 5 days, and that was fantastic. I mean, this was single-handed. done very well. This was the first time. And then after that, I went to Khartoum in Sudan. And again, I've done a series of kidney transplants. I started the first kidney transplant in Abuja, the capital of Nigeria, never done before, in 2011. And since then, we've done over 550 kidney transplants in Nigeria, which is amazing. And they're all life related. They're all done respecting the Istanbul Declaration, because all the cross matches are done either in South Africa or in the UK or in India, but we all checked properly. And so this, again, another city where I've done, and more recently I've done, I think 17 or 18 kidney transplant in Ghana, in Accra. And again, this is a fantastic experience because see, you go, you teach local surgeons how to do it. And I always like to say, I don't like to leave scars behind. I want to leave skills behind, because, you know, when you teach people how to do it, you're proud of what you have achieved by showing them the way to do it. And surgery, you can teach anyone how to do surgery. You don't have to be even a surgeon, or you don't even have to be a doctor. In Africa, we are now training nurses how to do a hernia repair, because you can do it. You don't need to be a surgeon. You have to be skilled. This is what I think. You can be a Nobel Prize winner and not be skilled enough with your hands. And this is why I think it is something which I love doing.
Yeah, interesting. Yeah, so I was going to ask how you ensure that these places then carry on their own, but it is all about training that next cohort of.
And the beauty about Africa is that, you know, whoever comes to watch, they don't need admitting rights and permission. It's all open. It's everybody can come in, open the door. Surgeon from different part of the country can come in, even scrub in, without having to have fill papers the way we do it in the West. So this is another big advantage. You see, you can teach anyone who is avid of learning. And now you can't, in London, you can't get anyone through the door unless they are GMC registered. That's how it works.
Yeah, yeah, of course. No, that's totally understandable. Yeah. So I wanted to go on to some of the kind of innovation that you've been part of, and you've been part of several world firsts, haven't you, in surgery that I know of. When that happens, what do you feel in the operating theatre? Do you feel excitement or fear? What goes through your mind?
Actually, I have to be honest with all humility. I never feel fear in the operating room, and I've had a lot of near disasters, and thank God I always manage to reverse that disaster. And that's why I do not believe in fear in the operating room. I could be scared outside or before, but when I'm doing it, I'm always very, very positive. Even in front of the most disastrous encounter, I feel that by being positive, you can reverse anything. And for me, nothing is impossible in the operating room. And I can give you some examples later if we have time. But in summary, I believe that if you are positive in what you're doing, you can always manage to produce something exceptional. And doing firsts, a lot of people, when we did the first hand transplant, people said, "Oh, it's a folly," but you know, we ended up doing it. The first time I did a kidney transplant in Abuja was in a small house. It was not even a hospital. It was a converted house. I remember we did it in the living room, and we used the dining room as an ITU. It was tiny, and people, when I show pictures to a crowd of doctors, they say, "This guy is crazy. How could he even dare?" But you know, I dared doing it, and it worked. Now, you can have the best operating room in the world and lose a patient, as we well know. you know, I heard of disasters, even now, in top first class hospitals in the world where they lost patients.
Mm.
So it doesn't matter. I think it's the knowledge and the willingness to succeed, which I think makes a big difference.
So you think that mindset is very important in what you do and in the operating theatre, and the positive mindset?
100%. I mean, you know, I, I give you a small, very short, if we have a bit of time. You know, I was doing a live related kidney transplant at the Hammersmith a few years ago now. It was a live related mother to daughter, can't remember. But anyway, next day, I got called by the hospital. I was on the ward, and they said, "Oh, there's no fluid to the kidney. It's gone." I said, "My God, this is a disaster. You know, I can't take this." So I took the patient to the operating room and I explored the patient, and the kidney was completely black, black, just completely black, not even pink, brown. It's completely black. I said, "My God, what a disaster! It's gone." So, but luckily, I said, "No, I'm not going to accept that." I just milked the vessels, and there might have been a clot there. And after milking the vessel, it pinked up. It became red within 2-3 minutes. I thought, this is unbelievable. Usually, a kidney which has been almost necrotic cannot recover, but it did on this occasion recover, and the patient went home with a perfect kidney function. So again, you have to be there at the right time. You have to be good at what you're doing, and you have to be very lucky. I always say, Napoleon always said, "I don't want to have a good general working for me. I want a lucky general." And I think surgeons have to be not only good, they have to be lucky.
Lucky as
And
well.
thank God I happen to be a lucky surgeon with what I do.
That's very good. I like that. So I want to move on to leadership, which clearly you're president-elect of the Transplantation Society, but you've had lots of other leadership positions and international organizations, etc., over the years. What can I ask? What have you learned about leading surgeons in particular, who are not the easiest group of people to lead?
Yeah, I think you're right. Surgeons are not the easiest, but I mean, my first experience as a leader of surgeons is when I was the president of the International College of Surgeons, based headquarters in Chicago, and we had sections in 105 countries. So it's a huge planetarian college, and indeed, you have to be a chameleon in a way, because each country has got a different structure. You have to speak to each chapter differently. And I think the answer to your question, you have to modify the way you function depending on who you are talking to.
Right.
You know, I think it applies to my current position as the president of the American College of Surgeons, the UK chapter, but the same thing applies, and the Commonwealth, etc. So I think the answer to your question, surgeons are sometimes big-headed, and it's not easy to lead them, but you have to, be a diplomat too. I think that helps.
Have you made any mistakes as a leader?
Yeah, of course. I mean, we all make mistakes sometimes. When I might be a bit too stubborn in my opinion and not take the opinion of other people. But I think we now in 2026 have changed a lot the way we behave as surgeons. I miss a little bit the way my bosses used to be allowed to be behaving, but now we can't do it anymore. We are, it's too much of a democratic world, and we have to respect
Which
and
has
be all.
positives as well, of course.
Of course, but this is why we have to adapt.
Yeah. So talking about your TTS presidency, if you were to fast forward 10 years, what would you like to have changed, or what would you have liked to have achieved that you then see the outcome of in 10 years' time?
I mean, my hope and dream is, first of all, to increase membership of the society and enlarge it to the low middle income countries, and maybe allow them to be members for a less cost for them as a fee. That's number one. Number two, my pledge is to expand transplantation in mainly Africa, where there are so many patients who are in need of transplantation. They survive on dialysis, and sadly not for too long, and they can't afford it. So if you can expand the number of transplant centers in Africa, and not have it only in Ethiopia, Kenya, Nigeria, and Ghana. For instance, the French-speaking countries in Africa, the West Africa, haven't got much of transplantation. So if we can expand on this, which I'm trying to help the AFRAN, which is the African Society of Transplantation, to do this, with the help of philanthropy too, which I tried my best to get as much funding as possible, and I'm usually successful in doing that, because some people want to donate money only as long as the money is used for Africa, which can be very useful to the African continent.
And TTS as a global organization has a responsibility to look at transplantation all over the world, especially in developing countries.
Exactly. I mean, we hear now obviously the introduction of robotic surgery, but some people do not realize that some people in Africa have nothing.
Yeah.
For the price of one robotic transplant, which costs a fortune, you can maybe transplant 50 patients in Africa. So we should not be pushing in the introduction of robotic surgery in Africa before we give them at least the basics.
Of course, yeah.
That's what I feel.
Yeah, that makes sense. What worries you the most about the future of transplantation, would you say?
I think the worry will always be the lack of donors. You see, if we had the luxury, for instance, of having a successful xenotransplantation future, where we can have an endless number of kidneys being produced without having to worry about having a live donor, for instance, this would be the future of transplantation. Because sadly, we still have disasters with live donors. Even in 2026, we hear about, God forbid, the death of a live donor, which is the biggest catastrophe you can ever think of. But it happens.
Yeah.
So think about a successful xenotransplant program where you can have the production and the supply of an endless number of transplants. So my worry is this might not happen in the near future, might happen maybe in 20 years, 30 years. And until then, we have to struggle getting in as much organs as possible.
Of course, yeah, it's one of the big bottlenecks, isn't it, in the field? Absolutely. Okay, I have two more questions for you, just kind of looking for the future, towards the future, and some advice really that you might be able to give younger trainees. So if you could give one piece of advice to your younger self as a younger surgical trainee, what would it be?
Spend more time in the operating room. I think this is sadly not happening less and less. And I can tell you why I'm saying this. My own son is a surgical trainee. He's a vascular trainee and a transplant trainee. The amount of skills he acquires in the operating room today is maybe 1/10 of what we were getting 20 years ago or 30 years ago. So this is, I think, something which I would advise young surgeons to, if they are working or training in the Western world, to still go to other countries where they have less technology, but more operative skills. And this is why I advise my son, for instance, to go to India, to go to Africa. When I go to Africa, he comes with me because he can see much more in a weekend than he would see in 6 months in London. And I'm not exaggerating. Because when you have a kidney transplant in London or in Oxford, you have to share the operation amongst 3-4 different fellows. One will do one side of anastomosis, the other one side, one ureter, one will close. That's not how you can train fast enough. And this is why I would advise my younger fellows to take advantage of when they have time to go to other countries and explore so that they can learn more of a cosmopolitan technique than just learning from one person.
And of course, that broadness as well, of seeing lots of different things, is always useful. You never know when some skill you've learned in another operation comes in handy. And I suppose that's also a problem in general with surgical training, where we become more and more specialist, and then we can't perhaps deal with things that happen outside our specialty, which can become
Yeah,
problematic.
it's funny. I was talking to an Italian doctor two days ago, and very competent surgeon. And she said, I've only done laparoscopic nephrectomies. So if I'm in trouble, I have no idea how to deal with it open, because she's never seen it open. You see, this is the disaster of, sadly, modern technology. And guess what? When they do it robotically, this becomes even more difficult. And this is where you end up having problems, because you can, let's say you have a disaster doing a robotic surgery, you try to fix it robotically, by then the patient might expire unless you open. And people are tempted not to open. Oh, let's fix it without opening. This is when you lose the patient.
Yeah. Good advice. Yeah, nothing can replace surgical time and surgical training and hands-on training. Absolutely. Okay, last question, Nadey, and then I know you're a very busy man, and then I'll let you go.
My pleasure.
What still excites you to get out of bed in the morning after everything you've already achieved?
I still, whenever I wake up, I still won't feel like going to the hospital, see my patients, try to book more cases. Like today, I got an email because I'll be going to Africa next Friday, and they send me a list of 10 patients we're going to do in 3 days, 10 kidney transplants. And someone on the group said, are you serious? Are you going to be doing 10? And I said, this is not enough. Let's do 11 or 12. So he started laughing about it. But this is my, what excites me is to be able to do more and more transplant. And actually, I have to admit, when I go to bed at night, in order to go to bed and to sleep, I think of the steps of having to do a kidney transplant with ureter, and I fall asleep. So I love it. I love it. And some people hate it. Some people get bored of doing the same thing again and again. But again, we go back to what I first said. It's a small miracle you have performed by having a successful kidney transplant after an hour of surgery, which is amazing.
Fantastic. Find something you love. That's the most important piece of advice. Thank you so much, Professor
Thank you,
Hakim.
Fadi. It was such a pleasure always. And thank you for allowing me to join you in a podcast for that program. Thanks a lot again.
Thank you so much. Take care. All the best. Thank you.